My name is Sarah Robertson. I'm from the Robinson Research Institute at the University of Adelaide. Our institute is interested in research in reproduction, pregnancy and child health. And we're particularly focused on understanding the determinants of fertility and infertility, but also the processes and events that influence the development of a healthy child. So particularly we focus on the events of very early life and the time around conception and how that influences the likelihood of becoming pregnant and the progression of the pregnancy to make sure that the fetus grows in the best possible way and a healthy child is born. So our research is showing us, together with a lot of other research around the world, that events at the time of conception are absolutely crucial for establishing really a healthy embryo, healthy implantation, and determining how the baby will grow to make sure that that child will be born in the best possible situation to be establishing a life course of health. Research around the world is now showing us that many of the diseases that affect children as they develop, and especially what we call the non-communicable diseases that can establish and become important as the child grows into an adolescent and an adult, things like metabolic problems, obesity, which of course set up the individual for heart disease and diabetes in later life, are all programmed into the child really from the time before birth. And this is extraordinary. It means that when a baby's born, it's already carrying the information that will influence susceptibility or resilience to later challenges that will, I think, have a major impact on that individual's life. So parents can have a major influence on I guess importantly, whether the pregnancy is established, and we already know that, but also whether their child will live a healthy life. And parents can, I think, as they're planning their conception and trying to become pregnant, already be thinking about how the choices that they make, especially the diet that they eat, their exposure to different chemicals, smoking, choices around using drugs, exercise, and all these other factors that influence our health, how this will not only be important in establishing a pregnancy, but in programming the health of the child after birth. Often we think that it's the mother's health that is important, and clearly women must be healthy if they expect to establish pregnancy. But importantly, it's both parents, and the father can have a major impact as well as the mother. So especially choices around smoking and exposure to chemicals, particularly in the workplace, can be really important for men. The DNA that's in the sperm, and also now the composition of the sperm and the way the sperm carry other kinds of information, what we call epigenetic information, that's carried forward into the embryo and then the child, is influenced by whether or not men are exposed to factors in the environment. So amazingly, particularly the research around smoking is showing us that there are chemicals that pattern the surface of the DNA and carry forward information into the embryo, and exposure to chemicals that are in cigarette smoke or other chemicals in the workplace, the diet of the man, whether or not he's overweight or obese, all of these things have an impact on the quality of his sperm and the information that's carried forward into the fetus and the child. Now, this sounds often like kind of doom and gloom, and that people might be concerned that they aren't, despite trying as hard as they possibly can, that they're not necessarily going to be in tip-top health. And I think we all do our best to try and be as healthy as we can, and this is an extra reason to be healthy. But I think also there's another message in the work that's emerging, and that is that this is an opportunity for parents, both mothers and fathers, to give a gift almost to their child, even before the time of conception. It seems almost that the benefit of the experiences and the choices that parents make before they conceive is a way that they can establish in the child set a trajectory, kind of feed into the legacy of the perpetuation of their family in a really amazing way. And I think that people should really be excited about how they can deliver the benefit to their child if they make the right choice as they're preparing for pregnancy.